Pulmonary hypertension is a relatively newly described disease, first clinically defined only in the 1960s, available pathologically well before that when we started to look at congenital heart disease. But it is essentially high blood pressure in the arteries that run through the lung to pick up oxygen, and it impairs the delivery of oxygen as well as the ability of the right ventricle, which is a weak sister by design, to pump blood to the left side to pump it out to the body with oxygen. The early symptoms are shortness of breath, which frequently is shrugged off as deconditioning or upper respiratory infection or smoking or asthma. But then in its most severe forms, the right heart starts to fail and people develop what would be called right-sided congestive heart failure. The treatment was initially tried was defined as relaxing the blood vessels, and until we got specific blood vessel dilators in the late 1990s, we really had only one treatment, which was to give intravenous prostacyclin, a substance all our bodies make, but people with pulmonary hypertension don't make enough of it. And this drug is unusual. It has a very short half-life and therefore has to be given continuously intravenously. So people wear a pump on their hip and have a permanent intravenous line inserted under their collarbone to pump the drug in 24 hours a day. Up until recently, all the treatments have been drug-related, pills or inhaled substances of some type. However, from the Biomedical Innovation Program, we've developed a mechanical solution for the treatment of pulmonary hypertension that makes the arteries more compliant, more supple, more normal. And that's in an early stage of development. The university is uniquely situated at the intersection of basic research and translational research, so that we have the time, if you will, and resources to look at these off-target or oddball, if you will, in the beginning, ideas and follow them through. Some work, some don't. But in pulmonary hypertension so far, we've had a very high success rate that has influenced the way the world thinks about pulmonary hypertension and its therapy.